Welcome to another video of Pearls of Medical Nutrition. Today's topic of discussion is anemia. Anemia occurs when your body doesn't have enough red blood cells. The condition is mainly caused by blood loss, the destruction of red blood cells, or your body's inability to create enough red blood cells. The most common type of anemia is iron deficiency anemia. Red blood cells contain a protein called hemoglobin. Hemoglobin is full of iron. With sufficient iron, your body can make the hemoglobin. It needs to create enough red blood cells to deliver oxygen rich blood throughout your body. The recommended daily allowance for iron is 10 milligrams for men and 12 milligrams for women. Although anemia treatment plans are individualized, most require 150 to 200 milligrams of elemental iron daily with over the counter iron supplement until optimal levels are replenished. Dietary interventions. Add following foods to your diet. Leafy greens. Leafy greens, especially dark ones, are among the best source of non-heme iron. They include spinach, kale, collard greens, dandelion greens, Swiss chard. They contain folate, which helps synthesize RBCs. Some greens high in iron, such as spinach and kale, are also high in oxalates. Oxalates can bind with iron, preventing the absorption of non-heme iron, but keep in mind that don't depend on them solely to treat the condition. Meat and poultry. All meat and poultry contain heme iron. Red meat, lamb, and venison are the best sources. Poultry and chicken have lower amounts. Liver. It's rich in iron and folate. Seafood. Some seafood provides heme iron. Shellfish, such as oysters, clams, scallops, crabs, and shrimp, are good sources. Most fish contain iron, for example, canned or fresh tuna, mackerel, fresh perch, fresh or canned salmon. Although canned sardines are good sources of iron, they are also high in calcium, which may bind with iron and reduces its absorption. Foods high in calcium shouldn't be eaten at the same time as iron rich foods. Fortified foods. Many foods are fortified with iron. Add these foods to your diet if you're a vegetarian or struggle to eat other sources of iron. Fortified orange juice, fortified ready to eat cereals, foods made from fortified refined flour such as white bread, fortified pasta, foods made from fortified cornmeal, fortified white rice. Beans. Beans are a good source of iron for vegetarians and meat eaters alike. Some iron rich options are kidney beans, chickpeas, soybeans, black eyed peas, pinto beans, black beans, peas, and lima beans. Nuts and seeds. Many types of nuts and seeds are good sources of iron. They taste great on their own or sprinkled on salads or yogurts. Some nuts and seeds that contain iron are pumpkin seeds, cashews, pistachios, hemp seeds, pine nuts, sunflower seeds. Tip: no single food will cure anemia, but eating an overall healthy diet rich in dark, leafy greens, nuts and seeds, seafood, meat, beans, and vitamin C rich fruits and vegetables can help you get the iron you need to manage anemia.